evening. Good evening. This is Dr. Yonnette coming to you with another episode of Baby Talk. I know you're wondering how come this time. Yes, this is not our usual time, but you can tell that I had a really hectic day. So I am now getting in our Baby Talk, and I didn't want to just let it go. So here we are continuing our discussion on raising a child who is overly sensitive to sensory stimuli. So we talked about some of the systems that will be affected, and today I want us to focus on a couple of systems, the olfactory system and the gustatory system. Those two systems, if we have time, we'll go on to talk about the tactile system today. So we are working with this child. Let's look at the olfactory system. And you know, when we talk about the olfactory system, we are talking about, yes, hearing. Now, let's see if what the literature says about this. When you work with a child who is overly and I'm saying hearing for auditory. Olfactory is actually smell. When you work with a child who is overly responsive to sensory stimuli and it comes to smells, you need to try to work with this child to figure out what is a noxious stimulus for the child versus what the child would accept. Because not every smell is going to be noxious to the child. So you have to work through that and help the child figure out what is acceptable. You have to prevent or present to the child nice and calming smells, scents, so the child feel relaxed. And allow the child to eat in a low populated and highly ventilated area. You give the child opportunities for regrouping and calming. So the child is there participating, he or she falls apart, move him away, give him a chance to pull himself back together and then return him. So that's what we're looking at for the olfactory system. So you would notice if the child is overly responsive to to stimuli and it's affecting the olfactory system, you'll see the child will be plugging the nose, complaining about odors, gagging at smells, wanting to throw up at certain smells. He or she would refuse to eat with others because the smell is pervasive in that area, and the child can develop feeding issues. So those are the things you're looking for, and then use the strategies that I just discussed a minute ago. Now let's go to the gustatory system. And here we are looking at what are some of the behaviors that you would expect to see from a child who is having difficulty in this system. The child would gag or vomit when food touches the lips or even the tongue. The child would become anxious and avoid eating at times. You'll see that the child has a very small food repertoire, or it's restricted, and he or she will complain about the food being too hot or being too cold. Now, when you encounter these difficulties in your child, what you want to do to help the child regulate this system is to allow visible, tactile, olfactory exploration. I'm saying olfactory. Olfactory exploration. Yes, and I'm actually right. Olfactory exploration, because they're all connected. You want a child to explore food. Give the child 10 opportunities to explore foods without having to eat the food that is presented. You want to present one type of food at a time. Don't give him 3 or 4 different foods, different smells, different tastes to work through at one meal. Present one new food at a time. And then you want to make sure that if the child is having a lot of issues in this area, get an occupational therapist to do an assessment, a feeding assessment for that child. And then lastly, let's look at tactile. We have a little more time. Let's look at the tactile system. What should you expect from a child who is overly sensitive to sensory input when it comes to this tactile system? And I want to pause here before I continue and say, parents, don't overlook these experiences that your child may be having. Stop and address them. Don't brush them away as, oh, please, just get over it. Stop and address them so that your child can get the care he or she needs, and they can develop the way you would want your child to develop normally. So in the tactile system, you are looking at what happens with this child. The child will be quick to withdraw from touch. He's overly responsive to sensory stimuli. So if you touch him, he wants to move away. It's noxious to him. He refuses to wear certain clothes. You know, the tags on his clothes and certain textures really bother him. And, you know, when he is with peers, he may look to be very aggressive. He may hit his peers, whoever bumps into him, because this is like his defense. Stay away from me, because when you touch me, it doesn't register well in my brain, and so I don't know how to deal with that input that is coming to me. So that child may appear aggressive and hits and bumping. If somebody bumps into her, he may hit, or if somebody gets in his space, gets too close, they may be aggressive to other children. And then they may complain of things being overly messy, you know, paint and glue and food. Those things are very noxious to that child. And he or she would be quick to wipe and wash his hands off. And that child too, you would notice when it comes to holding things in the palm and holding the pencil properly, that child may end up having, you know, that he just doesn't want anything to touch the middle of his hands, so he's holding as finicky as possible on the pencil to keep it away from him. What do you do in this case when the child has some tactile issues? How do we address those issues? We'll talk a little bit about it today and then finish it up tomorrow when we meet again. So you want to give that child proprioceptive and deep pressure input. So proprioception is actually giving him massages, pushing his joints into each other so that they're like kind of like connecting. So you're pushing the wrist into the wrist, the fingers into the fingers. You're waking up the body and giving the body an opportunity to understand where the muscles are, where the joints are, and where the body in general is in space. You want to have the child participate in purchasing their own clothing or selecting the clothing that he or she feels comfortable with. You want to wash the child's clothes several times before the child wears that pants or shirt. And you want to make sure that when you use glue with a child, use glue stick instead of the liquid glue, so that the child can participate in school activities that require cutting and pasting. Improve the child's independence in work, for self-care, for clipping the nails and brushing the hair. So you want to work with a child so that he or she becomes independent doing these activities, and that way he can determine how much input he or she needs to give to himself. And then help the child to slowly explore various textures so that he becomes comfortable with them. This is Dr. Yonnette coming to you with another episode of Baby Talk, and asking you to be careful to look out for what your child's needs are in these areas. Remember, take care of you and take care of baby. And I'll see you again tomorrow.